Great. Well, thank you very much to the organizing committee for having me here. I think that nutrition and any form of arthritis or inflammatory type of condition, well, let me back that up. Anybody that eats needs to know about good nutrition. For those of you here that are individuals living with scleroderma, I've got some information that may help you. For any healthcare providers that are working with individuals with scleroderma, there's probably some good nutrition tips that you might take away. And for anybody that's a caregiver, a family, or a friend who supports that individual with scleroderma, there's some other information. So do not feel that this is directed just to one set of population. Good nutrition is important for everyone, as I just mentioned. And there's no one diet for scleroderma. And as a matter of fact, about 15 months ago, I probably had my first patient that presented with symptoms of scleroderma in the family health team. And I went, oh, what do I do? Now, I've been working with individuals for over 20 years, but I didn't know all the specifics. So I did my homework and I helped this gal out, and she hasn't been back to see me. So I'm hoping that's a good sign that, that things are going well. But what I want to keep in mind is that good nutrition is a part of your day-to-day care. And as one lady said to me at lunchtime, she goes, I never thought about nutrition. You mean what I eat can make a difference? And I said, you know, it may not cure, and I know it won't cure your scleroderma, unfortunately, and it won't cure your arthritis, or it won't actually take away all the pain and the discomfort. But if it helps you tolerate things and it allows you to have less side effects of some of the other medications and treatments, then you know what? Score one for good nutrition. What good nutrition will do for you, though, with scleroderma is promote adequate nutrient needs that are being met. So if you're someone that can't eat every day of balanced diet, then having extra nutrients when you can pick them up will be advantageous for you. It will help you to achieve and maintain a healthy body weight. Now, for some of you, that may be going this way. For some of you, it may be going that way. And as well to prevent muscle wasting. As we get older, our muscles waste away. That's just normal physiology. But with an autoimmune or a chronic condition like scleroderma, we may have more muscle wasting. That affects our body's ability to tolerate treatments, to take medications, just to have day-to-day energy and wellness to do things. So we want to prevent that muscle wasting. And then, of course, it's the symptoms. So anybody here taking at least one pill a day? Okay, yeah, right. Okay, even if you don't have scleroderma, you might be taking something for your blood pressure, your cholesterol, your diabetes, whatever. And we know that with those medications, as wonderful as they are, come side effects. And a lot of those side effects will affect our appetite or how we digest foods or whether we're absorbing various vitamins and minerals in our system. So that's something else to say, hey, maybe having a good diet or knowing some nutrition tips will help me out here. So we're going to talk a little bit about that. Now, as I was going through, as I said, with that first patient I saw about 15 months ago, I thought, okay, so what is it that I really need to apply good nutrition or some healthy eating tips to? And of course, we know there's the vascular issues, and treating hypertension with diet is one of the pillars of treatment, not just the medication, not just staying away from alcohol and that, but watching what you're eating. We know that there's stress on the kidneys and the heart, anything that has blood supply going through it. So good nutrition can help with that. We know that when we have scleroderma, we've got this overactive, immune system that's sort of attacking our system, producing extra things in our system. So if we can decrease the inflammatory response at a cellular level, and so people say to me, well, will eating all that broccoli and all those omega-3s really help that pain in my joints or make digestion a little bit easier? Well, not on the spot. The side effects or the benefits aren't immediate, and that's where we have to be patient. So if nothing else, I have to encourage people to be patient with things, because nutrition isn't always I see the immediate benefit right away. It's sometimes down the road. And that's the other problem with my field, is that we're only an emerging science when it comes to healthcare, and so it takes many, many years of watching how people are eating and what foods make a difference in symptoms to actually come up with proper recommendations, ones that are credible, so that you're just not taking something off the internet or that infomercial at 2 o'clock that says, hey, try this new fad diet, it's going to cure your symptoms there. And we know the last one is the fibrosis aspect. So if it talks about the GI tract that goes from up here to way down at the other end of me there, a lot of things can happen from a nutrition perspective that can go wrong. You could have problems with reflux. I had someone say to me at lunchtime, yeah, you know, things sort of get stuck right about here, and they feel like, you know, I can't really swallow properly. Some of you might say, wow, I've developed a lot of diverticulitis. I've got bowel issues. I've got bowel issues going the other direction. So those are a lot of the symptoms that can happen as a result of fibrosis in our intestinal tract. What about just motility and trying to open that can of tuna with your hands there if you've got problems? Or going for a walk, or those of you that might have been active playing tennis or golf and you don't have that mobility. Those are all things that the fibrosis and nutrition might have a link to. So if I look at vascular, first of all, what I wanted to do was give you a little bit of the background, and you've got some of the notes in your package here. They only limited me to 24 note pages. So anyways, some of the practical applications I wanted to have on a separate one, sort of like this is my cheat sheet of tips and tools. And I've left that on the Scleroderma table at the back at the outside of the conference room here. So please feel free to pick it up. I only brought 100 or so copies, and I think there's more than that here. So if you would like, after the conference, they will upload it to the Scleroderma Hamilton website, so you can get a copy of it there. But that's where all the little tips and tricks are there. But from a vascular perspective, we want to reduce plaque formation from a nutrition or a dietary perspective. We know that it's going to happen with the disease, but let's watch out for saturated and trans fats. So that's pretty much the same guidelines for a heart-healthy diet. If we can reduce the stickiness of what's in the blood cells there, okay, and not necessarily with taking medication, maybe some of you are taking medication for that, but watching the omega-3s and boosting that aspect in your diet, having more fruits and vegetables from their antioxidant perspective, that's going to help reduce the platelet aggregation in the blood. And then protecting our kidneys. Though that's probably the biggest organ along with the heart that has the blood vessels that might be affected. So watching our sodium intake. Now I noticed they did a pretty good job at lunch today with not adding a lot of salt. Some of you might went, wow, there's no taste to this. But you know what? Adding some pepper, or I've got some samples of Mrs. Dash at the back there, might be a solution for some of you if you go, oh, I really like salt on my food. Let's try to cut back on the amount of sodium. I mean, all Canadians need to do that, is cut back on the amount of sodium and see if that helps. Watching out for protein. Some of you might be saying, hey, you know, I got to have my protein shake or my protein powder. Actually, that taxes or stresses our kidneys even more. So you don't want to be eating excessive amounts of protein in your diet. Chicken breasts for lunch, a couple eggs for breakfast, and some fish at supper. That's not what we're talking about. I'm talking about 2-3 scoops of the protein powders that might just put the balance of your diet off with the protein. And then drinking plenty of fluids. So it might be the water that you've got in front of you. I see someone's had a coffee. Might be some juice. It could be the occasional soda if you want. It could be soup. It could be whatever kind of fluid that you prefer to have, so that you're getting that and that's flushing things out of your kidneys. So the heart-healthy diet recommendations are try to cut back on animal fats as much as possible. Okay, the skin on the chicken, the marbling around the beef there, the 2% or the homogenized milk, the cream that you might be putting in your coffee, maybe using skim frozen yogurt or low-fat frozen milk as opposed to having ice cream. And hydrogenated vegetable fats, we usually find those in packaged foods. Now, the problem is most individuals that have difficulty with preparing meals from scratch or from a convenience perspective, we buy packaged foods. That's where most of the hydrogenated or the trans fats are. So you really need to be careful with those there. Limiting sodium to less than 2,000 milligrams is my personal recommendation. You may see 1,500 in some documentations. It's difficult to get down to 1,500 milligrams of sodium. A bowl of your favorite soup, canned soup, probably has about 600, 700 milligrams of sodium in just 1 cup of that soup. So that's half of your day's intake just there. Okay, so really be careful with that. Try to avoid table salt if possible. I say to people, you know what, we still have to live though, and if you really need a little bit of potato chips in the afternoon to get you through, okay, a handful maybe. So I'll say 1 salty food per day, but be very careful with that. I'm definitely everything in moderation. One of the ladies came through and she was holding, I think she was just trying to balance things out. She didn't want to be too heavy with the vanilla custard in one hand and the chocolate, so she put the chocolate in the other hand. So she was balancing things out. I don't know if I meant that kind of balance, but that's okay. And then last but not least, I always tell people, take this out, take that out of your diet. And they go, geez, are you going to tell me any good news? My good news is, how about increase your intake of fish? Okay, so it could be canned tuna, it could be canned salmon, but you know, if you have more of the omega-3 sources of fish, the salmon, halibut, trout, mackerel, even sardines, those are really good sources of omega-3s, and we'll talk about the benefit of those. Fruits and vegetables for their antioxidant effect, those are sort of more from a protection. You'll get the fiber that's going to help with the bowels. And soluble fiber is the last one, because soluble fiber can also help just keep our GI tract healthy from an immune perspective or an inflammatory response. And anybody that needs antibiotics at any time, having soluble fiber along with probiotics is sort of a wonderful cocktail to help avoid some of the bowel effects that you know sometimes happens with antibiotics. Now, here's where I said be careful with those foods there. I've got that list for you. Anything that's processed, prepackaged foods. Instant oatmeal is one that a lot of people may not realize. I promote convenience foods, but why the food manufacturers have to put salt in instant oatmeal, I have no idea. So even if you can prepare the oatmeal in advance and then have it to heat up later, that's a better choice. Be careful with the condiments. It's the barbecue sauce that flavors that dry chicken. It's the steak sauce on things, the horseradish. That's what you need to watch out for. Vegetable juice, great way to get your veggies in, but a lot of them are salted. So you can look for the low sodium versions, or take your vegetables themselves and blend them up in a blender and have your own little cocktail. So I talked about the vascular aspects, so now the immunity factors. So I know that we don't want to enhance your immune system, and for the most part, that's what most people want to do. I want to build up my immune system. I'm going to take this supplement or eat this type of food and everything. Well, I think for people with scleroderma, your immune system is working overboard anyways. So what we need to do is decrease the inflammation at a cellular level, and there are certain foods or sort of the combination of how we eat foods that will lower inflammation at a cellular level. One, we start with a balanced diet. So if you don't have a copy of Canada's Food Guide, I think I did bring enough of those. So please pick one up to review. You may have seen it from public school. Maybe your kids have a copy of it or your grandkids. But a lot of us have it, but we don't follow it. So that's a good start. Reducing the saturated and the trans fats that I recommended from the vascular perspective, that's also going to help with the inflammation. Cutting back on simple carbohydrates and refined grains. Now, that's where a lot of people say no white foods. So watch out for the white refined bread. Watch out for the refined white pasta, the refined cookies, things like that. It's not to say that you can't have them, but for a lot of cases, when we refine things, we take out a lot of the nutrients, and what's left is just pure white flour. Now, why is white flour such a problem from inflammation? It causes our body to secrete insulin, which is a hormone that causes more friction or inflammation in the body. So even if you don't have diabetes, it's still a worry to have lots of insulin circulating around in our system. So the more you can watch out for the refined grains, the better off you're going to be from an inflammatory and immune system. And then last but not least is achieving a good ratio of omega-3s and omega-6s. Now, some of you might be going, whoa, you lost me there. Okay, I have no idea. I've heard about omega-6s, but I have no idea or I've heard about omega-3s, but I have no idea what omega-6s are. And I'm sure there's at least one biochemist in the audience that could come up here and tell you better. But what I'm going to tell you is that on a whole, we do not get enough omega-3s in our diet relative to the amount of omega-6s that we eat. Now, omega-6s come from things, our vegetable oils. So sunflower oil, safflower oil, sunflower oil, those types of things. Usually good from a heart disease perspective. Well, that was a couple slides ago. However, when we're talking about inflammation, we want to have more of the omega-3s. That's the fish oils. That would be flaxseed oil. That would be walnuts. So even though you thought almonds were a really good snack to munch on, I'm going to say, hey, try some, instead of almonds, try some walnuts. They would be a better source of omega-3s. When you alter the ratio of how many of the omega-6s you eat to the omega-3s, it causes a change in what's called prostaglandins at the cellular level. And when there's a little bit of friction there, there's almost a competition, it causes your body to heighten up its immune system. So we're actually promoting an environment that's causing our body to rev up that immune system there. So if we can get more of the omega-3s and less of the omega-6s in our diet, one, our heart will still be healthy, and two, it will help us from an inflammation perspective. cutting back on alcohol. You see, I did not say cutting out. Now, you may need to talk to your healthcare provider there, because there may be some medications or in some situations that you shouldn't. But I know there's lots of evidence out there that says a little bit of red wine does help your heart. So you check before you start in on that. Caffeine, really need to be careful, because that can also affect the vascular, but it can also affect inflammation as well. And one of the other ones that I've read over and over is watching for dietary pollutants. That's sort of, I think, the politically correct way to say any additives, preservatives, dye number 2, red, whatever. And I think that if I look back and I go, hey, how come my grandparents didn't have some of the health issues that I have now, or that I see with my patient population? And how come they could eat, bacon or cured ham, and they had eggs every day, and they drank milk straight from the cow, and they didn't have arthritis like we do? Does it have something to do with some of the dietary pollutants? Never mind our environmental pollutants, our dietary pollutants. So the more you can have things the way Mother Nature sent them to us, that's probably the better route to go. I know it's not always possible, but the more you can try, that's what we want to do. And promoting good gut health. So pre and probiotics. Now, a lot of you might be familiar with probiotics. Of course, you know that commercial with the little gal doing her hula dance with the Activia. Oops, I'm not supposed to use names here. With that yogurt that promotes good gut health. And that's the probiotics. Those are those live cultures. Well, our immune system starts in our gut. Our gut is actually one of the immune organs. And so if we can promote good gut health and make sure that things are moving through there properly, we're not going to get the little sacs filling up, the diverticuli problems there. We're not going to have the constipation. We'll get the absorption of nutrients. But that has to start with having adequate probiotics and prebiotics. And prebiotics are a type of soluble fiber. Oh, I mentioned that in the vascular section too. Are you starting to see a trend that even though I'm talking about different aspects of how nutrition and scleroderma link up, that some of these guidelines are similar? And if you're someone that's already has diabetes or high cholesterol, or maybe you're watching your weight and have recently had a diagnosis with scleroderma, or you're dealing with that as well, it's not like we have to reinvent the wheel. You can continue doing a lot of the things that you were supposed to, or maybe it's just more incentive to continue doing things or make some additional changes that will help you in the long run. So I said that important thing about lowering the ratio of the omega-3s, 6s to 3s. I always say omega-3s to 6s. The ratio right now for Canadians is something like 20 to 1. So for every 20 grams of omega-6s, we have maybe 1 gram of omega-3s, because not a lot of us eat fish on a daily basis. And I don't know how many people here put ground flaxseed on their food, and how many of you pick walnuts over almonds to snack on. But I'm sure that a lot of people have salad dressing, or that they're frying up their veggies or stir frying. They're putting maybe corn oil or sunflower oil or safflower oil in the pan there. So we tend to use a lot more of the omega-6 products. To lower that ratio, eating more seafood, having things like the walnuts, leafy greens, even using avocados are a smaller source, but those would be better sources to boost the omega-3s and sort of lower the intake of the omega-6s in your diet. So even if you're not trying to lose weight per se and you need fats, it's these healthy fats that we want to have in our diet. There is some evidence, and I think we'll see more and more supporting it, that omega-3 supplements. So there might be people out there that just hate eating fish, or you're allergic to fish and you can't have it. But by taking omega-3 supplements, you will get the benefit of decreased inflammation, improved vascular health by using them. And the studies have been shown in the rheumatoid arthritis arena, or in that area, that joint stiffness and even pain and use of some of the pain medications has been greatly altered with the use of more omega-3s. Now, when we're saying omega-3s, we're talking about taking 3 to 5 grams of these supplements per day. Well, if anybody's ever taken them, you know that they're pretty big horse pills. And if you have difficulty swallowing, that's not a good thing, because they're definitely going to be something that's you're going to be choking on. You can get them in different forms. But my biggest worry is that omega-3s have a blood thinning potential. And if you're someone that's already on a blood thinner, whether it be aspirin or whether you're on Plavix or something else, this could cause you to just have a little paper cut and find out that you're, bleeding profusely. So if you do want to go that route of using the omega-3s, they're perfectly healthy, but you should talk with your doctor or pharmacist to make sure that they don't interact with any of the medications that you're currently taking. In fact, I'm going for some elective surgery, and they actually said, hey, if you're taking any omega-3s, stop them. I said, don't you worry, I will. Okay, so that's my spiel on having more of the omega-3. So those probiotics that I mentioned to you, they're good bacteria that usually stay in our stomach. But when we get a lot of those dietary pollutants or even other environmental pollutants, it decreases the good bacteria in our stomach. And when we decrease the good bacteria, we don't have that immune factor or that our body's ability to absorb certain nutrients. And that's where things like celiac and certain food allergies can actually come from, is because we've broken down the good bacteria in our gut. So we have to somehow get more into our system. How do we do that? Yogurt's a good one. Kefir or fermented milk. Miso, tempeh, some juices and soy beverages now are even fortified with the good bacteria. You might be familiar with the terms acidophilus, bacteria bifidum. Those are some of the two good ones from a yogurt perspective. And basically, a half a cup of a active culture yogurt per day can actually enhance gut mobility and reduce any sort of problems that people might have, like gas and bloating, even lactose intolerance if you're taking a yogurt that has live cultures in it. Some people will take the supplements. You may have seen the Bio-K and some of those other brands out there at the health food store or in the refrigerated section of the grocery store. They can also be beneficial. If anybody's traveling, that's a great thing to take to prevent the Montezuma's Revenge or some of the food poisonings that can happen if you're going down to the islands or where there may be some other bacteria. But the prebiotic has to come with the probiotic, okay? They're like, twins. You got to take them together. And a lot of people don't. So they take these probiotics and you've got this live culture, but you've got nothing to actually activate it and make it work. So it's almost like saying you've put the grass seed down, but you haven't put any fertilizer or you haven't put any rain on it to cultivate it. So we need the prebiotic, and that's where a lot of people aren't familiar with, is the prebiotics. So prebiotics are things that are fiber in our diet. So having a high fiber diet with lots of fruits and vegetables will increase your prebiotic. Having legumes or beans, so if you're cutting back on your meat intake and boosting your protein from beans and legumes, you'll get some more of those prebiotics. And some of the fiber supplements that are out there, Metamucil is a prebiotic, the type of fiber that they use in Metamucil. Benefiber is another one. It's got something called inulin. Chicory root, people will buy chicory root, grind it all up, and they'll use that as a soluble fiber as well as a prebiotic. And FOSs, those are fructooligosaccharides. Try to say that 3 times over. That's another type of fiber that they'll put in a lot of food products, like some of the yogurts now, they'll say with added fiber. So they realize we got the probiotic, we better put the prebiotic in it because all these people heard Pam talk on Saturday and now they're all running out looking for it. So the food manufacturers are now incorporating some of these extra nutrients into our foods so that you don't have to remember to do, I took this, I took that, I took that. We're combining them all together. Okay, so that last factor that I was mentioning there is the fibrosis factor, that thickening of the gastrointestinal tract. If that's something that you've experienced, it's going to make it difficult for chewing and swallowing. So a lot of times people say, you know what, I'll just have the fluids, I'll just have some soup. So it can definitely alter your nutrition absorption or whether you're getting an adequate diet. Vitamin mineral deficiencies will result, and it may affect malnutrition. And as I said, for some people, it could mean that they're not getting enough nutrition and they lose weight. And for others, they find it quite easy to swallow a milkshake. And so if you get one of those high-calorie milkshakes, then the being underweight may not be the problem. It could be being overweight that is more of the issue. And the other aspect of the fibrosis is the motility. So things are getting caught up here, or maybe you've got this feeling of early satiety or feeling of fullness. You can only eat small quantities, or it's not moving down along and it either feels like it's going to come up or it's going to stay down here and you end up being uncomfortable with constipation. So those are some of the nutrition things that we need to pay attention to. So how do people manage the swallowing issue? Well, the one that I recommend isn't even a nutrition issue. It's like eating when you've got the most energy. So if you want to pick your best meal or the meal that you really enjoy eating at a time when you're well rested, when your muscles are well rested, not after you've just done an hour talk, to a group of people. My muscles here are really sore after a talk. I just want to be quiet. I don't want to eat my food then. Taking small, frequent amounts. Okay, and when I say small, frequent amounts, I mean even a teaspoon. So going back to some of my dysphagia or swallowing difficulty classes, it was like, take a teaspoon of food at any one time, because you'll have the least likelihood of choking on a teaspoon of food, especially if it's going to go down the wrong area and go down into your lungs. So 1 teaspoon of food at a time, swallow it, and then move on to the next teaspoon. It may take you a little bit longer, but that's okay. Liquids are easier than solids for the most part. For some individuals, they may need those liquids thickened a little bit. So you can get various commercial thickeners, or some people will just put a little bit of cornstarch in their soup to thicken it up, maybe a little bit of potato puree. So if you find that you're coughing, you're sputtering when you're taking really thin liquids, we may need to thicken those up. I would probably make sure that we get you to a dietitian or a speech language pathologist to help you with the right swallowing or the right consistency there. But for the most part, maybe a bottle of Ensure or Boost or one of the Breakfast Anytime, a homemade smoothie is a better option than trying to eat a dry sandwich that maybe I told you to eat 10 years ago, sort of thing, because that was a good meal at lunchtime. But maybe you need something like a liquid complete meal that way. The more you can have the consistency be the same amount, so a homogeneous consistency, the better off you're going to be. Some individuals that have swallowing difficulties will say, you know, when I'm trying to have beef noodle soup, I've got liquid soup going down, I've got this beef that I've got to chew, and then I've got these vegetables that I sort of have to chew, and it's really difficult when the muscles aren't working properly in your esophagus to swallow all of that. So it's better to puree things up. So have a pureed up soup. Buy one of those little hand blenders or one of the little mix master things there and puree things to make it a little bit easier. Those vegetables were done pretty good in my opinion. They could have been a lot softer. Then people wouldn't have enjoyed them maybe. They could have been a lot harder, and then people would have been saying, oh, I just can't chew those. What happens when you don't chew or you don't have the muscles to chew? You swallow it whole. What happens when you swallow it whole? You choke on it. If you don't choke on it, it will actually absorb water and prevent urgency. Wonderful to know if you're going to be not knowing where the nearest bathroom is. Inulin, that's what's inside of Benefiber and the inside of fruits and vegetables. So if you're experiencing bowels that are running frequently, just eat the inside of your fruits and vegetables and stay away from the skins or the peels. If you're experiencing constipation, you may have a laxative that's helping you, but the insoluble fiber, that's wheat bran, the skin and the seeds of fruits and vegetables, is what you want to have more of. And if you're someone that is at risk for diverticulosis, or you've had an episode of diverticulitis where the particle goes into the little pockets in your intestinal tract and stays there and gets infected and you have to go on a clear diet, okay, by having lots of fiber going through your system and we move it along, there's less likelihood that it's going to pop into those little pockets there. So we do want you to have fiber in your diet, maybe not the little seeds that get stuck in those pockets, but the other foods like the wheat bran or the skins that would actually pass through there and prevent the fiber or the little residues from getting caught in those little pockets there. And by all means, do not forget about the fluids. You need water, whether it's to make you go so that you don't have quicksand in your belly without any fluids, or from the other perspective with the soluble fiber, because that helps to make things gel up and slows down the intestinal tract. So reduce muscle wasting. How can we do that? Well, following Canada's Food Guide again. Remember, we're all going to use that copy of that. For individuals with any type of chronic illness, I recommend a multivitamin, because there's going to be those days, as I mentioned, that you can't eat according to Canada's Food Guide. And you may need a little help or nutrition insurance from a vitamin or a mineral that you're not getting. If you can try to get 3 meals a day or 6 smaller meals, that's the best route to go. And a general rule of thumb is to have 3 out of the 4 food groups at your meal. 3 out of the 4 food groups ensures that you're getting some carbohydrates for energy for your muscles, so it reduces the muscle wasting. You actually have fuel in your muscles. And it also gives you a little bit of protein to prevent protein being the muscles being broken down. So it's actually encouraging repair of the muscles as well as keeping them fueled, so you've got that energy to do your day-to-day activities. If you have a poor appetite, try to pick high-calorie foods, okay? If this is usually a short-term kind of problem, and I will say to people, you know what, cookies and a little bit of chocolate or ice cream maybe aren't so bad if it's a short-term solution to gaining extra calories in, or if you're experiencing some weight loss. It is not a long-term solution, so you cannot live on a diet of potato chips and regular Coca-Cola. But if you can, add extra calories to things like adding skim milk powder to your milk to get a high protein milk. using a little bit of extra olive oil or canola oil added to your pasta or to your rice or in your soup, that will give you some of the extra calories that your body needs. So I've got this on the list too. So cheese and peanut butter, eggs, nuts and seeds. I've got some coupons out there for Break Free, those egg substitutes. That's a liquid egg substitute. It's low in saturated fat, so it's not going to hurt you from a heart disease perspective, but it's going to give you some protein. If you don't feel like eating, a chicken breast or an egg or a piece of meat, then eggs are a really good source of protein. So if you want to grab one of those coupons out there, you're more than welcome. Yogurt with a bit of granola, custard. The fact sheet says chocolate. It should have said chocolate or rice pudding. So not just chocolate by itself. That's not necessarily, well, it is a high calorie snack, but not one of the more nutritious ones. What happens when calories going in are greater than calories going out? Well, definitely we don't want you gaining extra weight. When we gain extra weight, it's usually around the middle section if we're not active, and that increases the amount of leptin, which is a chemical in our body that will increase inflammation. So I know that if people are carrying extra weight, that's also going to make it more difficult for moving around or doing their day-to-day routine. And in fact, 1 pound of extra weight that you're carrying is the equivalent of 4 pounds of load on each of your joints. I usually bring around, and my colleagues from the arthritis, I know I have this 5-pound bag of fat that I usually plop in front of me, and it just really annoys people to look at that 5 pounds of fat and go, ooh, I probably have about 2 or 3 of those on my body. But anyways, the effect on your joints is even more. So whether, it's actually having to do things or just whether it affects your ability to, have the most energy or fatigues you, we want to try and reduce the amount of body fat that we're experiencing. So limiting high-fat foods, drinking enough water, increasing fiber, those will help with the portion control, and then doing whatever physical activity you can do. Maybe you were a world-class runner at one time, and maybe now you can just walk up and down the hallway in your apartment building. That's fine. Whatever you can do to burn some extra of the calories that you're consuming. Now, with the amount of time left, I wanted to talk a little bit about drug and nutrient interactions. A lot of people might be taking anti-inflammatories, painkillers. So we know that if you don't eat them with foods or you don't take them with foods, that can really start to rot your stomach. As someone asked me yesterday, I'm overweight. I can't afford to be eating all these, these foods and everything. And I said, you know what, a half a piece of toast is really all you need, or 4 soda crackers is all you need to take with your pain medications, or you don't need a full meal. So cautious with that if you're someone that's carrying extra weight or doesn't need to gain weight, and you're wondering, how am I going to eat this extra food while I'm taking my medication? When it comes to those vascular agents, the ones for your blood pressure, keeping everything going well with your blood vessels there's usually people have a greater risk for potassium depletion. So you may be on some potassium pills. Besides bananas, oranges, spinach, potatoes, sweet potatoes, avocados, melons, those are all great sources of potassium. So you just don't need to be eating bananas because you might get sick of bananas. Calcium is really important, and so is magnesium. Now, if you're eating various fruits and vegetables, you will get potassium and magnesium from there. Calcium you will get from dairy products if you're having that, or some other fortified products. If you're taking antacids for that reflux or for any of the motility agents that can sometimes decrease your body's magnesium intake, calcium and B12. So again, it might warrant meeting with a dietitian or speaking to your pharmacist even to do a diet history, or your other healthcare provider, whether it's a nurse or your doctor, to sort of see if you're at risk for vitamins that are depleted as a result of other medications that you're taking. And the last one was those antibiotics. If you're needing those, vitamin K, the B vitamins, and vitamin D are all ones that can be depleted if we're taking those. So we need to prevent that from happening. And it may mean that you need to take a supplement that has a higher amount in some of these nutrients. But definitely don't go out on your own and take the highest, mega dose of a certain nutrients, because it again may distort the balance in what you're eating. Good sources of vitamin C, B12, calcium, I've got them listed there. In the essence of time, I'm going to pass through these ones, as well as vitamin D, potassium, and magnesium, because I've got those on the fact sheet for you. But I did want to make a comment about dietary supplements. As I mentioned, I am someone that likes to promote food before supplements. So foods first, supplements second. However, I know that some of us need extra supplements. Maybe it's those omega-3s, maybe it's the probiotics, I definitely think a multivitamin would not hurt anyone, and fiber might be another one. But what I want people to be cautious is of the mega doses, or those ones that we see on infomercials, or sometimes when we go into the health food store and they say, oh, you've got an inflammatory condition, you got to take the high dose of the B12, or you need the magnesium for this. I want you to know why you're taking a high dose of anything, and is it going to cause further complications or side effects. So do not think that because it's a dietary supplement and it's not regulated because the pharmacist, you know, didn't have, or you didn't have to get a prescription from the doctor, that that's healthy for you. So there can be just as many side effects or ill health consequences by taking some of these dietary supplements. The ones right now, when I Googled supplements and scleroderma, the beta-carotene, bromelain, gotu kola, sulfur, essential fatty acids, MSM, there's tons of them out there. The chondroitin, there's so many that you could be using. Not going to say that they don't work, but in a lot of cases, there's no clinical evidence to say that they do. So what else do we need to worry about? Well, if you have diabetes already, maybe you have to worry about your sugar intake. What about our ADLs? Okay, and I'm sure that all the therapists have talked about this in the past, but I know that if it's difficult to prepare meals and chop up those fruits and vegetables because you've got problems with dexterity, that maybe you're not going to eat that. Or if you don't have enough energy, how are you going to have enough energy to actually eat a meal if you can barely just get out of bed before those pain medications start taking effect? So we need to consider those things. Skipping meals due to a busy schedule. Well, you know what? I came here at 1:30. Thank goodness I came early enough so I got to have lunch before I did my talk. If you've got appointments and labs that you have to go for and you have to fast and everything, a lot of times it's our busy schedules that sometimes prevent us from eating. Not because we couldn't, we just didn't have that opportunity to. And then the other ones that I know you'll be hearing about probably later is the financial, the emotional, the social isolation that will impact our eating habits. If you're out of work, you may say to me, but Pam, to eat healthy costs lots of money, and I can't afford a lot of fruits and vegetables that are fresh. And I can't afford those drinks that you're talking about, even though that's what I need. So working with a dietitian might give you some other solutions to all of these indirect nutrition concerns of people that are living with the scleroderma. Conserving your energy. Planning is a big one. So if you can have your best meal earlier in the day or when you're most rested, that's the same as that energy conservation from a muscle perspective. Small, frequent meals will help. Plan meals and groceries when you have energy to do it so that you're not left with a house or a fridge that has no food in it and going, oh, well, I guess I'll just have to dial and get a pizza for takeout type of thing. So, so better planning can also mean better nutrition. Meals on Wheels is not just for the senior or the elderly population. You can use them at any age or lifestyle or stage of life, and other meal delivery services. Making large batches of foods, having convenience foods on hand can be very useful when you don't feel like food preparation. Smoothies, that's another one. I do believe in, I mentioned the milkshakes, but making a smoothie with some yogurt, putting some fruit in it, maybe actually even adding a little bit of veggies in there. You'd never know when you put carrots or even spinach or rapini into a fruit smoothie, and you can get a very balanced meal that way. So that's that sort of liquid nutrition diet there. Mood boosting foods, water, vegetables, and fruits. So if you're not feeling all that great up here, never mind the rest of the body, making sure that you're drinking enough water, having enough fruits and vegetables, having the omega-3s, and having those complex fruits and complex carbohydrates. That's the same as less of the refined ones that I told you about 20 slides before. And I want to make sure that you're getting the most bang for your bite. So having variety and moderation, thinking color, and don't let eating become a chore for you, because that's when it's difficult. There's two guides that I do recommend for people. One is the food guide that I've referred to here, and I have copies. And the other one is a nutrition and arthritis booklet from the Arthritis Society. They're a great wealth of information for various types of inflammatory conditions. And this booklet here has pretty much everything that I talked about, plus a lot more in that booklet there. So I would definitely refer you to that resource. I think, actually, if I go a little further here. I'm going to go right to that one there. If you contact the Arthritis Society or go to their website, you can get that resource. They've got a lot of other information. They've got support services, the therapists that work with them. As Susan mentioned, the Arthritis Society has a nutrition class here in Hamilton and in Mississauga. So if you're interested in attending those, be more than happy to have you attend those. And the last one is the Eat Right Ontario website. There you can talk to a dietitian or get information about specific meal planning or food ideas that might help you managing day-to-day nutrition issues. I'm going to stop there because I'm already a minute over.